Okay, good. So Hassan, share with us a struggle or that you went through during your training, and you can make others' life easier by sharing a piece of advice or a pearl wisdom tip.
I think regarding the training part, interestingly, I'll be very honest, I had a lovely, it was a lovely walk throughout my 3 years training, because Professor Asif Zafar actually had such a structured program that I can't really point out that I was not able to get anything, like, for example, getting my share of surgery. However, as we are talking, the moment I went and came into this medical college, I think I realized that the thing I earlier mentioned, that maybe it is not really a structured system, not a merit-based system that makes you through up to the ranks and maybe the way you get your piece of work. So regarding post-graduation and being part of a medical college for the last 15 years, there I felt a little bit of problem. And that is something, believe me, I do slightly slowly start teaching to the undergraduates also, that this ball game is different, and you have to understand that you have to be very, very emotionally intelligent. So the big talk these days, the emotional intelligence is really playing a big part. It's no more the IQ, it's the EQ, you know. So I guess that is more of
Wonderful. I see you are using terms that we are recently reading about it. So you are way up in the game of what's out there, because personal growth is directly related to emotional intelligence. And as you mentioned, getting to people to think about what their life would be like or what they want to do, start thinking about that sooner is important. I didn't realize what I had to do until I had to make the decision, and sometimes it made me learn the hard way. So what you're saying is that go out and make people be aware of what they are going to do, or let them start thinking sooner, right? That's what you're trying to do. Wonderful.
Absolutely.
Very innovative
Can be
thinking.
done.
Now, is there anything that you want to go back and change your life of medical school, that you say, I wish I did that more, I couldn't do it, I wish I could go back and fix that? This is related to life in medical school.
Uh, to be honest, not much really. Really a big time Lahore yani admirer. But yeah.
Okay. I think that this, what you were saying is that other than being in Lahore, everything else was good. Is that
Yeah,
what?
to be
Because there
honest,
was a
I'm fine.
little bit of
Fine.
connection problem.
Not real big, not something big which pops up in your mind. Can yaar aise ho jata? Not really. I'm really satisfied,
Okay,
mashallah.
good. Now, is there any? It seems like that you went back to Sargodha to serve your community, and you're doing it. Is there something that you want to do more in terms of giving to the community you serve or underserved people?
I think I strongly believe that the teaching hospitals in Pakistan, these second tier cities, again I speak of cities other than Rawalpindi, Lahore and Faisalabad. Other than that, like Sargodha, cities like Chakwal, Sialkot, slightly smaller cities, I think we are really lagging behind. I don't think so. We are up to the mark regarding providing services, starting from basic sterilization to, like seeing more than 150 patients in the OPD, and then maybe sometimes really not uh, in the evening times, not really managing patients according to the protocols. So, but I don't know. I'm really confused because being a physician, being a surgeon at my role, even if I become head of department in 2 years, I'm not sure that I can really contribute largely to the whole fact, because as far as my unit is concerned, it's been 1 year I've been in charge of my unit too. I do give a little bit of any effort, energy to organize it, but this is a big problem. And I'm sure you all know that it is not structured. The patient care is way away from the evidence-based practice, and it's not really good practice. So maybe
Great
some
point
good.
that you raised. So I'm going to ask you a question. Let's say we see you 10 years from now, inshallah, you are the head of the hospital, head of the university, dean, and you have budget, and you were facing COVID-19 type of a situation, what would you like to do to make this situation better in your city?
I think again, like the guidelines we all know for the last 4 months. First of all, the awareness to the normal community, and second, the most important thing these days, our frontline, the healthcare providers, they have to be trained how to, I mean, manage with this. I mean, these days they are talking about no more about that there is lack of PPEs. Now they are telling how to manage, how to make. You see YouTube videos making masks of different kinds, and then managing the PPEs and those washable PPEs maybe sometimes in our part of the world. So maybe I mean, if I would be around, I would be really focused to my healthcare providers, and second thing would be just
So
as much as I can.
what I'm hearing is that you would like the healthcare setup infrastructure to be more organized. You would like the more access to personal protective equipment, and you would like the younger population to be engaged in their future career goals sooner, and maybe
Exactly.
educating masses, public, and improving medical literacy, and
Absolutely,
knowing
absolutely.
when to seek help. Wonderful. So that concludes our professional part. Okay, so I'm gonna pause it here, and then we will record our second part, which our viewers should come back and watch it for the more fun part of the
Okay,
conversation. Okay, all right.
fine, fine.
Hold on there for 1 second.